Assalamu alaikum. My name is Anusha Aftab. My roll number is BP1650033 and my topic is anti-hepatitis B immunoglobulin. Hepatitis B immunoglobulin HBIG is prepared from plasma containing high concentration of hepatitis B antibody and it is used to protect a person from hepatitis B. It can provide short-term protection, that is 3 to 6 months from infection. Before hepatitis B vaccines were available, HBIG was only the product for post-exposure prophylaxis. Hepatitis B immunoglobulin is not a vaccine, that's why it will not provide long-term protection. For long-term protection, you must receive hepatitis B vaccine. Then we have indications. Number 1, acute exposure to blood containing hepatitis B surface antigen. Number 2, in newborn when mother is carrier of hepatitis B virus. Number 3, sexual exposure to hepatitis B antigen positive person. And number 4, exposure to person with acute hepatitis B virus infection. Then we have side effects. The common side effects are dizziness, sweating, back pain, headache, muscle ache or pain, nausea. Now I have mentioned all the doses of hepatitis B immunoglobulin, that is prevention of hepatitis B in case of accidental exposure, at least 500 international units depending on the intensity of exposure as soon as possible after exposure. Immunoprophylaxis of hepatitis B, that is 8 to 12 international units per kg with maximum of 500 international units every 2 months. Prevention of hepatitis B in the newborn of hepatitis B virus carrier mother at birth or as soon as possible after birth, that is 30 to 100 international units per kg. Drug interaction. Adverse effect can be shown and increase when immunoglobulin combined with these drugs, and these drugs are adalimumab, alemtuzumab, alirocumab. Now we have the irrational and rational uses of drugs. Hepatitis B immunoglobulin is used to prevent hepatitis B in people receiving a liver transplant and in babies born to mothers infected with hepatitis B. It is also used to prevent hepatitis B in people who have exposed to hepatitis B through contaminated blood products, sexual contact with an infected person, or living in home with an infected person. HBIG is injected into muscles or into vein through infusion pump. It is usually given soon as possible after exposure to infected person. It is also given part of a liver transplant, and then for several weeks. Medication is usually given to transplant patient every day for 7 days, then every 2 weeks for 11 weeks. And these are the 3 brand names mentioned with the prices. Now we have a case study in which a 50 years old gentleman who underwent liver transplantation. Besides his immunosuppressive, he received ampicillin 1.5 gram Q 8 hours for 24 hours. After transplantation, he also was started on TMP SMX 1 tablet Monday, Wednesday and Friday. Nystatin 5 ml TID, lamivudine 100 mg daily, and Valgan cyclovir 900 mg PO daily. What is the rationale for the mentioned agent? Should other measure be considered to prevent infection? Now we have SOAP notes, and in subjective we have severity, that is 15% to 25%, location is liver, symptoms there is no symptom in patient, history is liver transplant, and these are the medications. Now we have object, and in object of the SOAP notes we will discuss all his lab reports, which are as follow. The Ben level is 16 milligram per liter. The SRCR level is 79.6 micromole per liter, which is also normal. ALT level is 22 international unit per ml. Blue ribbon is 6 micromole per liter. And albumin is 42 gram per liter. His BP is 140 to 150 or 85 to 90 mmHg. His vital signs are as follow, that is heartbeat is 105 beats per minute and his temperature is 36.8 degrees centigrade. His lab reports and vital signs are normals. Now moving toward the assessment. Hepatitis B immunoglobulin is an important component of prophylaxis in hepatitis B virus infected person who are undergoing liver transplantation. Hepatitis B immunoglobulin HBIG 10,000 units should be started and should be given every day for 8 days after transplantation. The last part of SOAP note is plan, and in plan we have stated that combination of an antiviral with HBIG is currently more preferred. After the first week of HBIG, patient will continue to receive 10,000 units IV as a 1 to 2 hours infusion weekly for 4 weeks, then 10,000 units monthly for the first 6 to 12 months after transplantation. And these are the references. Thank you.